colleagues Brady and Elise and Noam. We are just, and Jolyn and Nicole. We are the Combined Fund Drive staff, and we are just thrilled that you could join us today. And I'm just so happy to learn about how the organizations that we're going to be hearing from are handling what seem to be hot fires popping up all over the world, and particularly in our 2020, what seems to be a very difficult year globally. So without further ado, I'd like to introduce Tiffany Wilt, who is the Corporate and Foundation Partnership Coordinator for Project Hope. And we are letting you just take it away, Tiffany, and your screen looks like it's working perfectly. So feel free to jump on in.
Great. Thank you so much, Dean. Very nice to meet all of you. I'm so happy to be here today to talk about Project Hope. It's an organization that I care a lot about. One of the reasons that I started working at Project Hope or even decided to work there is because I care so much about our mission and think that we add a lot of value to the world. So always happy to talk about what we do. So Project Hope is a global health and humanitarian aid organization. Our CFC number is 11115. You can see that up there in that blue bubble. And our mission is to place power in the hands of local healthcare workers to save lives across the globe. This is a really unique mission, if you ask me, because a lot of other global health organizations focus on patients, which of course we do patient work as well. But Project Hope takes a very sustainable approach, focusing on training healthcare workers so that they can continue to provide care in their countries and their local communities, even after we've left the places that we work in. So just to give you an idea, we work with healthcare workers, but we also work with individuals, children, mothers, parents, and the elderly. We span all ages. And then we also work in different areas. So anywhere from emergency response to maternal and child health. So I'll talk about that a little bit later. Our 5 areas of focus are communicable and infectious diseases. For us, that means tuberculosis. For the most part, we also do some other infectious diseases like HIV and AIDS. But more and more, we're seeing our programming is getting increasingly focused on non-communicable diseases. So the same diseases that are affecting us in the United States are growing across the world, and we're seeing them increasingly affecting, more less developed communities. So for non-communicable diseases, we do a lot of work in sort of the diabetes, heart disease, hypertension space. And then that can span different communities, which brings in our third programmatic focus, the reproductive, maternal, newborn, and child health section, which is in the healthcare space, a long acronym. We even get tired of saying it, RMNCH. But it's just a fancy way of saying that we work with children and newborns and their mothers. So we do a lot of work in the very early stages of pregnancy and also with newborns. And we've got programs all over the world focusing on that area. And then fourth is our disasters and health crises section. So we do humanitarian work. We have some work going on in Colombia right now, responding to the Venezuelan migration crisis. We also have some work in Yemen. And then we do a range of disaster response work. So hurricanes, tsunamis, earthquakes, and right now, for the past year, our main focus really has been COVID-19, because as you can imagine, a lot of our healthcare work has been severely affected by the spread of COVID-19 all over the world. And then finally, we have a health policy arm. So that's called Health Affairs. I personally don't work very closely with Health Affairs. So if someone has questions, I can try my best to answer them. But they're a really amazing branch of our organization. They focus mostly on health policy in the United States. And they allow us to have that balance between our international global health programming, which most of the work we do is international outside of the United States. And then they allow us to bring that work also back to the US and have a really big impact here, apolitically, but in a way that can help everyone regardless of their political stance. So Project Hope has been around for a very long time. We are an old organization that does really important work. So we started working in 1958. We were actually created by President Eisenhower as part of his People to People Health Foundation, part of the People to People movement. And since then, we've provided healthcare for tens of millions of people in more than 100 countries. We've trained over 1 million healthcare workers, and we've delivered over $3.1 billion in medicines and supplies. Hopefully, my screen isn't blocked. But you can see this picture of the SS Hope. So this is the first iteration of Project Hope's work. We would get volunteer doctors and nurses and other medical providers, and they would go on the ship and travel from country to country, delivering healthcare and vaccines to people in other countries. And as you can see from what I was talking about earlier, we really changed that approach, and we've made it much more sustainable. So much more country up as opposed to US down. Unfortunately, I'm missing a slide. I'm so sorry about that. But I did want to tell you guys more about our COVID-19 programming before we end. So we have COVID-19 programming all over the world. We're working in the United States with a healthcare training program that we partnered with New York Health and Hospitals on, but that also is available across the world. So it's a virtual training program. It's available in areas where there is very little to no internet access, and it can be accessed on a smartphone. So really incredible program. It's focused on training healthcare workers on how to deal with a pandemic, how to use PPE correctly, and how to treat patients, and also take care of themselves and their mental health. We also have, on top of that, a mental health resiliency program specifically targeted at healthcare workers, because healthcare workers are heavily affected by this pandemic, and we want to make sure that we're taking care of them. If our healthcare workers aren't healthy, then how are they going to treat us as we fall sick during this pandemic? And then the third thing that we do is we're actually responding to COVID-19. So we're delivering PPE. We have been since the first outbreak in China. So we delivered a lot of PPE to China. And then as the numbers in China started to slow down, we kind of pulled all that PPE out and started delivering it to other areas across the world. And now we've got that distributed in Mexico, in Sierra Leone, in Europe, in the United States, all over the world. And we also have some programs in the United States, even though before 2020 we were mostly focused internationally. Now we have volunteers and people providing surge support in hospitals that are being heavily affected by the pandemic and don't have enough nurses or doctors to treat people. So we're providing surge support in Chicago, Houston, Montgomery County, and Navajo Nation. Yeah, so I wanted to just show you guys some QR codes. You can take your phone and pull out the camera app and then just hover them over any of these QR codes if you want to visit our social media. Highly recommend, if you want to learn more about our programs, you visit our website. We have lots of stories on there, and lots of great information about Project Hope. So I'll open it for questions, or maybe wait till the end for questions, but more than happy to answer any questions that anyone might have.
Thank you, Tiffany. Everybody, please put your questions in chat and we'll answer them at the end. I also wanted to point out that the number that Tiffany put up is the combined federal campaign number. And I'll look up the combined fund drive number and post that in chat. I'm sorry, I'm coughing. I'm very happy now to introduce Trevor Eckhoff, who is the director of the from the American Red Cross of King County. And Trevor, it's your turn to take it away. So thank you so much.
Thank you, Dean. Let me share my screen here. All right, how's that coming through?
Yes, you are good.
Okay, great. Well, Yeah, thanks so much for having us here. My name is Trevor Eckhoff, and I'm an intern with King County Red Cross, and I work alongside our disaster program manager, Jamie Hill. It's just an incredible organization. I've been interning for 9 months, and I'm really excited to talk to you about it today. So with Red Cross, I like to go to brass tacks and go to our fundamentals. Red Cross is an old organization since the 1860s, and these are our fundamental principles that apply to every Red Crosser around the globe. And the two that really speak to me especially are impartiality and neutrality. Red Cross does not care who you are, what you're doing, just as long as you need help. We do not have caveats to our service. We do not pick sides. We just try to fulfill our mission of unabashed humanitarianism wherever it is needed and whoever needs it. So at the American Red Cross, we like to say that we are one Red Cross. And what we mean by that is we are all the same and act as one unit spread all over America. We have the same training, same positions, services, structures, and this really helps us not only act as one unit together, but provide all of our services uniformly and equally to all Americans. And everyone, I must stress this, everyone, no matter who you are, has a place in the Red Cross. No matter what you're interested in, your capabilities, our organization is made up of people and their contributions. So American Red Cross has 5 lines of service, which a couple of them, most of you have probably heard before. The one we'll go more in depth about today is disaster cycle services, what I intern for, and that's all of our disaster relief nationally and at local and regional levels. And then we have biomedical services. That's phlebotomy, blood drives. I'm sure you've seen our blood mobiles all around Seattle. And actually, Red Cross provides about 45% of the U.S. blood supply. Service to the armed forces. Soldiers take care of us, so we try to take care of soldiers. Like we said, we're impartial. We don't take sides. We merely try to provide comfort and well-being to soldiers, both active, in duty, in hospitals, as well as veterans. Our training services are, you've seen them as well. These are the folks that come to communities and teach about CPR and first aid, swimming lessons, lifeguard certifications, general caregiving, nurse care. We try to educate folks as much as we can about disaster and how to help people in need, both physically, mentally. And then international services are our last line of service. International services is all about international humanitarian law. The Red Cross actually back in the 1860s chartered the very first Geneva Convention. So it is very big on making sure that we're promoting this idea of humanitarianism all around the world, but particularly in our own country. So let's talk more about disaster cycle services. So what does the cycle mean? It's 3 things: prepare, respond, and recover. What that means is that Red Cross doesn't just show up once a disaster happens. We try to be engaged in the entire process of disaster response. And that begins with preparation. And then once the disaster goes, we'll go into response, and then we will stay with the community to try to help them recover, both the community at large as well as individuals through casework. Red Cross has 24/7, 365 coverage of every U.S. state, every single place. We give ourselves 2 hours to respond to a disaster and 4 hours, if needed, to open a shelter. Our most common responses are house fires. 90% of what American Red Cross does is response to single-family house fires. When the going gets tough and we have to scale our response up, then we can provide major disaster services during disaster relief operations, which we do along many other partners, both private, public, nonprofit. So let's go a little bit into what do we do in disaster services. We have 3 different kinds of service: our direct, our support, and our external. Direct is everything we do face-to-face with our clients. So a couple of examples would be mass care and client services. In mass care, that's setting up shelters, cots, blankets, providing meals. And then our client services, we provide casework at an individual basis, make sure that we're meeting people's unmet needs. And our disaster mental health and disaster spiritual care teams try to help people who are suffering mentally during disasters. That is a big part of what we do. Our support services, these are the guys that truly make everything happen. Logistics gets everything where it needs to be. They enable direct services to be able to provide all these things to the community. And staff services, those are the people that make sure we have people and trained people, good people, knowledgeable people, able to respond to disasters, like we said, 24/7, 365. We make sure that we have the folks to do that. And then our external services. External services is much like what we're doing right now. Red Cross wants to reach out to every single other organization because we can't do it alone, and we know we can't do it alone. We need everybody else, whether that's FEMA at the federal level or state and local emergency management offices, nonprofits, both nationally and localized, community partners, food banks, anything that we can start a connection and a relationship with to make sure that when the time comes, we can all coordinate and work together on a response. So if you see us in our community, in your community, you'll most likely see us in the form of disaster action teams. If you remember, I said earlier that about 90% of what American Red Cross responds to is single family home fires. So disaster action teams, we are reached out to by local emergency services, and then we go to the scene, conduct a damage assessment, and then we establish a relationship with the client, and we make sure to fulfill their unmet needs. And those key things from you need a place to sleep tonight, you need a meal in your stomach, you need a few $100 to be able to pay for whatever you need, just as long as we can get you through the next day and start your case to recovery. And I included some statistics here, if you can read them on your screen, about all of our disaster action team responses this year. And in November alone, we had 53 people we served, 15 incidents. And just a couple of days ago, we actually had a fire, which I believe we had 17 people in King County that we go ahead and started casework for. So the vision here, it says it all. The only way that we can do this is with the manpower of volunteers, partners, and our donors. People make the Red Cross possible, generous people, people that care about our mission of humanitarianism, unabashed and just no caveats like we established. And the American Red Cross, we serve a family in an emergency every 8 minutes, and 250 people receive a service from the Red Cross every 60 seconds. So that equates to about over 60,000 domestic disasters every year that Red Cross is responding to. And as it says at the bottom, 97% of our local workforce is volunteers. The Red Cross does not have a lot of employees. People do this because they know it's right, and they want to, and they want to help. And only through having the manpower of our own folks, generous donor dollars, as well as working with all these other organizations, can we truly make disaster relief possible. And, you know, I just want to say, what you might ask, well, why do I do this? You know, no one gets into this field for money. We do this because we care. And I've always wanted a career where I could tangibly help people and measure at the end of the day, okay, what did I do today that improved a system that we have that's going to help someone eventually, or what did I do today to help someone? And the Red Cross, it exhibits everything I stand for and care about. Like I said, unabashed humanitarianism. That is all about the Red Cross. No matter who you are, what you do, where you're at, what has happened, we're going to try to be there to make sure that you start picking up the pieces and are cared for. Your well-being, and hopefully we can alleviate physical and emotional pain. That's really what our services are all about. So I love this organization, and I hope I gave you a little glimpse into what we do. So thank you so much for listening to me.
Again, thank you, Trevor, so much. Again, if anyone has any questions, please put them into the chat and we'll be tackling those at the end of the meeting. Now it's my great pleasure to introduce Riti Rukopada from the Sexual Violence Law Center, and she will take it away. So, and again, Riti, thank you for being here.
Thank you so much. Thank you so much, Dean. Thank you also to the presenters who've presented so far. It's really, really amazing to see how much work is being done in the community. I am Riti Mugopade. I'm the director of the Sexual Violence Law Center, which is a small nonprofit law firm based here in King County, though we serve sexual assault survivors throughout the state of Washington. I am actually going to turn off my video. One of the downsides of being on Zoom is you have to see yourself talk all the time. So I'm going to turn off my video, but hopefully the PowerPoint has enough information to be interesting and you don't have to see my face for this. So as I said, I am with the Sexual Violence Law Center. We are a small but mighty team of 6 attorneys who provide legal assistance and representation to sexual assault survivors around the state of Washington. And our focus is to protect the privacy, the safety, and the civil rights of survivors. Our work is based in gender and race equity principles, and our goal always is to provide free legal assistance and representation to a survivor. A trauma of a sexual assault is devastating enough. No survivor should have to think about legal costs and think about financial need to be able to access advocacy and services. So before I go into the program itself, I just wanted to identify that there are 38 community sexual assault programs around the state of Washington. So these are programs that provide counseling and emotional support and basic needs advocacy to sexual assault survivors. However, there are no other organizations in the state of Washington that provide exclusive legal assistance and representation to survivors here in our state. The reason for the founding of our program was that in the past, if you were a sexual assault survivor, depending on the type of victimization or abuse that you experienced, you may not qualify for domestic violence legal services or domestic violence assistance. So for example, if you were assaulted by your classmate, if you were stalked by a neighbor, if you experienced sexual harassment by an employer, you could not access free legal services because that was usually dedicated towards domestic violence. And so we work with the different programs around the states, the different CSAP programs around the state, trying to make sure that if a survivor is needing an attorney, if they're going to the court because they're seeking safety or they have other legal needs, that we are able to be there with them and support them through that process. So what does our program look like? So we serve all gender identities, all ages, both adult and child sexual abuse survivors. Our model is holistic and trauma informed. So what does that mean to be holistic? So this means that we work to address every legal issue that a survivor faces as a result of the sexual assault. In 2015, Washington did a civil legal needs study, and they identified that the average indigent person experiences maybe 7 to 8 legal issues. So maybe their housing is being affected, their employment is being affected, maybe they have public benefits needs. Once you experience any sort of gender-based violence, domestic violence, or sexual assault, the number of legal needs that a survivor experiences skyrockets to 18 to 19 legal issues. And it is really hard as a survivor to have to go from provider to provider, go from attorney to attorney, and have to keep repeating that same traumatic narrative about an incident that most of us are trying to push out of our mind. We're trying to move beyond. And so recognizing that, we try to be a one-stop shop for survivors. And on average, we will end up representing a client in 5 to 8 different legal areas, whereas most attorneys will represent a client in only one area. We not only litigate, but our advocacy is also based on policy reform and legislation and doing appellate work, and then also education in the community. So doing trainings and workshops, not only training providers, professionals, such as judges, prosecutors, law enforcement, social workers, SANE nurses, educators. We've done trainings at UW around sexual assault and sexual violence dynamics, but also with the survivor community as well, ensuring that survivors know what their rights are and what their options are when they have experienced victimization. We assist survivors directly and really prioritize cases based on vulnerability. And the reason why I say prioritize cases, our goal is to never turn any survivor away. But because we are a small team, we cannot represent every single survivor who comes to us on their case. And so we provide 3 levels of services. The first level is hotline assistance. We have a legal line number, which I'll share at the end of this PowerPoint, that any survivor or their advocate or a support person can call with questions. A lot of times, somebody who's experienced a sexual assault isn't necessarily ready to jump into reporting to the police or getting a protection order or filing a complaint. They just want information. And so the hotline is there to provide basic information. The second level of services we provide is advice and counsel. So this is where maybe the survivor does have the resources and ability to navigate the system with just a little bit of support. And what we would do is essentially train them in how to be their own advocate, get them connected to community resources, help them draft responses, help them draft legal paperwork. But the survivor is the one who is still moving forward, and we are not representing them in the case. And then the third level is full representation. This is where we are in court, we are taking on opposing counsel, we're dealing with the prosecutors, we're dealing with judges who don't necessarily understand trauma and don't understand survivors and are inherently misogynistic and racist in some situations, some courts. And for full representation, we really prioritize the vulnerability of the survivor. So if the survivor is homeless, if they identify as a person of color, if they are undocumented, if they have a disability, we know people with disabilities have a higher experience of sexual abuse and sexual assault. If they identify as gender non-conforming or LGBTQ, 1 in 3 women will experience sexual violence in their lifetime. 1 in 6 men will experience sexual violence in their lifetime, and 1 in 2 non-binary or gender non-conforming individuals will experience sexual violence in their lifetime. So these types of vulnerabilities are something that we are very mindful of and prioritize for our representation. It's important because I did say that we base our work in race and gender equity principles. I also recognize that our work has to be intersectional. And by that, what I mean is, you know, this was a term that many of you know, coined by Professor Kimberly Crenshaw to describe how race, class, gender, and other individual characteristics intersect to often end up becoming a barrier for that individual and being able to access services, access justice. So we really try to apply these principles in our work. It's how we also prioritize cases. We are not a nonprofit that is taking the low hanging fruit. For us, if it is a difficult case, that is our priority, because there is just no way that survivor is going to be able to navigate a complicated system on their own without the assistance of an attorney. Besides focusing on the representation and advocacy of survivors directly, we actually do have some special initiatives that are also part of the Sexual Violence Law Center. And one of the examples of that initiative that I'm highlighting here, because it was actually founded by faculty, staff at UW, I think through the Safe Campus program. And now it's housed at Sexual Violence Law Center, is the Techie program. So this is an example of how digital technology has not only become more central in our lives, but they have also become a source of psychological abuse and exploitation and trauma for many survivors, because sometimes abuse can also take place online, or the technology enables perpetrators and abusers to essentially evolve their abuse as the technology also evolves. And that can have a devastating impact on a survivor, having to constantly change your email, having to disconnect from your online social community because your social media keeps getting hacked or you're being stalked, being concerned that your device, your phone or your laptop may be hacked or has been compromised. This can also become a source of trauma and can be very crippling to survivors. And so special initiatives like our Techie program, we have another special initiative where we are tracking sexual assault cases through the court systems in conjunction with community advocacy groups and paying attention to how Washington responds to sexual assault cases and where are the gaps in our legal system to be able to improve the system and better serve survivors. With the Techie program, and our Court Watch program, those are the special initiatives that a lot of times there are opportunities to also volunteer. So I would encourage anybody who is participating today to think about if you would be interested in volunteering with us based on some of our initiatives, or if you know attorneys who would be interested in volunteering in taking cases and representing survivors. Those are opportunities that I also want to make sure that you're aware of. And lastly, because we are in the middle of a pandemic, it's really important to also just identify that sexual violence itself has been an invisible pandemic. And with COVID-19 in this past year, the numbers have just increased quite dramatically. Our program, for example, we have seen a 50% increase in calls and requests for representation and assistance. And just the type of sexual violence that we are seeing is even more violent. And it's hard to even fathom, but it's even more violent than we've ever seen before. So to kind of talk about how we've seen the pandemic affect our work, the first is the sort of systems factors. I mean, all these consequences of sexual assault have just increased drastically. But we've sort of broken it down into sort of 3 areas: technology, mental health, and systems factors. So with the systems factors, this is seeing survivors having less access to courts, less access to counseling, less access to support, agency support, because of the fact that COVID has really changed how systems are responding. Online filing, where it was never allowed before, now courts are trying to adjust and trying to figure out how to move their systems online. Suddenly everybody's having to do phone conferences. Some counties are live streaming hearings to YouTube, which is a violation of privacy. So this is how we're seeing systems factors play in to exacerbate the experiences survivors are having during COVID. Next is the tech factor. I mean, this is also through the techie work, even more highlighted by the fact that technology, not everybody has equal access to technology as we're having to move online to be able to communicate. Not everybody has safe access to technology. There's increased opportunity to abuse and exploit survivors through online stalking, through doxing, as people are more active on social media and not necessarily thinking about safety issues because it's their way to stay connected to their community. And children have greater access to online systems and online platforms with less supervision as parents are working and also dealing with the fallout of COVID. And then the last area that we've been seeing increased need and related to survivors, it's mental health factors. This is because there is less access to counseling and community support, as many programs have shut down or they've moved to online systems that many survivors don't feel comfortable or safe using. Many survivors do not want to burden others when everybody is dealing with just so much in the community, and so are just self-isolating even more while their trauma is being exacerbated. And the fact is that Zoom fatigue is a real thing, and having to communicate about something really traumatic through a laptop or a video platform is hard for many. But those are just some COVID-19 factors that I wanted to highlight. And with that, I wanted to put our program information out here because even with this group, there are survivors or there may be survivors who will disclose to you in the future. And we always want to make sure that they get connected to the right resources and the right support. And so I hope not only will you support us, but you'll also share our information to the survivors in your life. Thank you.
Reedy, thank you. That was excellent. And I just have to echo what the last thing that you said is sometimes people are comfortable sharing things with someone that they're not normally connected to. For example, I worked at the law school for many years, and we had a student who revealed something very disturbing to one of our faculty secretaries who was a little older, came across as a grandmotherly type, and he told her something that needed intervention, and she knew what to do and how to do it. So do listen to your colleagues and do open yourselves to these conversations as they arise. Thank you, everyone. The presentations were terrific. I'm going to turn to my colleague, Elise, who's going to scroll through the chat. We have had a number of great questions that come up, and I know that all of you are looking forward to fielding those questions. So Elise, please take it away.
Hi, yeah, thank you. And thanks for sharing, everyone. So much important work. And I'm so glad that this is our last Lunch and Learn because so much of this work is so timely with the pandemic, but timely in very different ways, as we can see. And so I'm just going to go through the questions. Feel free to add in some extra questions as well. Noam asks, for Project Hope, what challenges or exciting opportunities did you find by moving your programming back to the US from mostly working internationally?
Yeah, there were quite a few challenges. Hopefully you guys can hear me. Um, we had previously had programming in the United States, so most of our programming in the US was across the Appalachian Mountains and those more impoverished areas, and then also in indigenous communities. Specifically with Navajo Nation. So that's one of the reasons that we came back to the US, because one of our contacts from Navajo Nation that we worked with in the early 2000s reached back out to us and told us that, you know, they were encountering a lot of challenges. They had really high infection rates, and they just needed support in their local hospitals. So that was like our first dipping our toes back into working in the US. And then we found, I should take a step back. The reason that Project Hope doesn't typically work in the US is because we find that there are other communities in the world that have health systems that need to be strengthened. And we had traditionally looked at the United States as being an area where there was no need for health system strengthening, right? Because we have this very advanced healthcare system. Where everyone receives, I mean, arguably expensive healthcare, right? But everyone has healthcare here. You can go to the hospital. In a lot of areas where we work, there are no hospitals. There are no, people don't even know, you know, how to deliver a baby, or, you know, people are dying from things like a very, very basic healthcare issues that really doesn't happen in the US. So COVID-19 has really changed our perspective on what a strong healthcare system looks like. And that's why we've come back. So we're working mostly with the elderly population. I know that is not a population that we typically work with. We have a couple programs in China focused on palliative care, so end of life care. But we're seeing such skyrocketing rates with COVID and the elderly population in the US that those communities and minority communities as well are the ones that we're focusing on. And I think we're just trying to take a flexible approach and kind of go against our model, which is that more sustainable healthcare worker training model, because the way that we think of COVID-19 is like a year-long emergency response, right? And when you're in emergency mode, you don't necessarily have time to train people. You just need to respond. You need to support. You need to be there right now. So yeah, we're doing lots of different things in the U.S., but I think we're having a really great impact, and I'm really proud to be part of Project Hope's team.
Yeah, thank you so much for sharing. All right, I'm going to go to the next question, which is actually for me, and this is for the Law Center. And you sort of touched on this at the end, but I was just wondering how, in general, clients find you and are able to access your services.
We try to be as low barrier as possible, so clients, survivors can access us through multiple pathways. If they're connected to a counselor or an advocate, they can make a referral to us. They can contact our legal line directly or send us an email, which I'll put in the chat as soon as I'm done. It's legal line at SV Law Center. That's on our website. Most survivors find us either online or through word of mouth, or before COVID, we used to get a lot of walk-ins.
Yeah, thank you. And then I have one from Dean for the American Red Cross. That's Trevor. And Dean asks, American Red Cross is a huge organization. How is everything coordinated?
So obviously that's the biggest, question of all time. But for sure we can break it down, since we are at American Red Cross one Red Cross. Our national branch in Washington, D.C. sends everything down to all the other regions and then the chapters in the regions. So we're all drawing from the same source, right? None of us are working on different playbooks. And then another tenet of disaster management is that you can scale your response based on what's occurring. So those disaster action teams that go out to a single family home fire, usually they're the only people that need to fulfill the lines of service. But if more people are affected and a greater area is affected, we can scale up that response from the chapter to the region and then have folks all here respond to that. And if the region's not big enough, then we can go to the division. Right? The division is the whole West Coast, the Pacific, and we can get all those folks going. You know, all of Red Cross, when there's a disaster response, a big operation in America, we have folks deployed from all around the country with different skills and requirements and such to be able to meet those needs. So the only way we're able to coordinate all these things is because we're all running on the same system with the same sorts of concepts in our head. And like I said, we scale our response based on what's occurring so that if we need further coordination, we can do it.
Yeah, awesome. Thank you. And so a question I have for all three of our speakers are, do you have any volunteer opportunities available and what do they look like? And I know that we touched on that there are some at the Sexual Violence Law Center, but yeah, I was curious what kind of thing that would look like. So thanks.
I just posted the contact information, which is my email if anybody is interested in volunteering. So for attorneys, volunteering looks like providing either representation or basic legal advice, and we provide the training on how to be trauma informed. And we provide like ongoing support, case support when attorneys are volunteering with us. For any non-attorneys who care about advocating for survivors and building a better system for survivors. There is the Court Watch program, which is tracking cases in the court and seeing how survivors are treated through the legal system, and through our Techie, our initiative, especially if you have a background in technology and are able to help assess survivors with their compromised like devices and how to better safety plan around technology. That is a great opportunity. And for any of you who are connected to Amazon or Google or Microsoft, please, please, please encourage your tech friends to reach out to us.
And I can tell you guys a little bit about volunteer opportunities with the Red Cross. Obviously, like we've all been talking about, COVID has changed our services a lot. You know, we can't directly go with our clients anymore, but we still are always going to be here fulfilling our mission, no matter what's going on in the world. And you can do anything you want at Red Cross. You go to redcross.org and read about all the different opportunities you have, both localized, deployment, virtual online experiences, whatever you want to do, Red Cross will find a place for you, and a place where you'll be happy, hopefully, and find something that drives your passions to engage with our mission. And like you guys heard, we have our direct, our support, our external services. We have so many different ways of volunteers being able to give their time. And I just encourage anyone that's interested, please go to redcross.org, check it out. There is a place for you, no matter who you are and what you do.
I'm muted. Isn't that the typical sentence of 2020? For Project Hope, we mostly have opportunities for healthcare workers, and we are actually desperate for healthcare worker volunteers right now. Normally, we only need healthcare worker volunteers when we're responding to some kind of emergency or disaster. But because COVID-19 is the longest emergency that we've ever experienced, we are permanently in response mode over the last year. We desperately need volunteers, and a lot of our, medical professionals are less likely to volunteer for us now because of the risk. So definitely in need of medical volunteers. We also frequently have postings for photographers, so that we can get images and pictures of our programs and our emergency responses. and then bring them back. And that helps us with fundraising to have, really good quality images that show the important work that we're doing. And as time goes on, we're posting more and more volunteer opportunities for like more office type work, staff support at HQ, and stuff like that. So I put a link in the chat to our volunteer portal where people can check out the opportunities that we have available. And you can also apply to be like a general volunteer and then put your kind of like qualifications or your interests in there. And then if an opportunity comes up, someone from our human resources department will contact you.
Thank you. All right, my last question, because I don't see any other ones in the chat, but you are welcome. Any of the participants are welcome to ask more questions. Is do you have any upcoming events that we could participate in, or anything? I know everything is pretty much virtual right now, but I know some people have some holiday events. So anything that you could promote that we could attend?
I guess I can go first because I'm still on video. We don't have any upcoming events that I know of, but if any come up, I will definitely share them. We do have an event. We have an annual event that we put on every year. Obviously, it's annual. And we did that in September, I want to say, and it's just sort of like a summary of our programs, a whole bunch of people who work on, who do our work. They gave nice like video submissions because it was all online because of COVID, and that's still up. So if you guys want to watch that and participate sort of like virtually post the event in that, it's a really interesting like virtual experience. So you like enter the meeting room and there's all these different things you can click on, and then you can watch the video recording of the event. It's really cool. Highly recommend. Yeah, and then if anything else comes up, I'll be sure to share it with Dean and Elise.
I just wanted to say we don't have any upcoming events. We usually have monthly trainings for volunteers, but we're rethinking our 2021 schedule. But we will be sharing that in January, and I'm happy to forward that once we have that up.
And for the Red Cross, unfortunately, we're the same thanks to COVID. Have anything, going on in person, but we do always need volunteers, and we're still always doing things with our volunteers. We love to have. We're going to have Zoom holiday parties and such with our chapter and our different teams. We always try to stay engaged with each other, right? Yeah, the best thing I can say is come on over and be a volunteer. You won't regret it.
Yeah, I just wanted to say that I think the kind of lack of events right now points to how difficult it really is to fundraise and engage people right now. And that right now, I'm sure all of these organizations could use donations more than ever. So I'm going to hand it back over to Dean for the last few minutes to close it up.
Super. Thank you, everyone, so much. And I posted on chat for those that are inclined to donate to any of these organizations, each or all, or volunteer or find out more information. I've posted their combined fund drive numbers in chat. I also wanted to let everyone know that soon the recording of this event will be up on the Lunch and Learn website. And tomorrow is our last day of the last week to give day. So be sure to check that out. Again, I want to thank all of our participants. Thank everyone who dialed in, so to speak, and please stay safe, be well, and thank you one more time.
Thank you so much.
Thanks, everybody.